Starting off in parasternal long axis view, you want your patient to be laying on the left lateral side, and your position of your probe should be on the third to fourth left intercostal space near the septum. Your notch should be facing towards the patient's right shoulder. In this view, we will see the left atrium, the left ventricle, the right ventricle, the aortic valve, the mitral valve, and the interventricular septum. In the next view, you would want to tilt inferiorly towards the patient's right hip to get the RVIT. In this view, we will get the right atrium, the tricuspid valve, and the right ventricle. We will then rotate the probe 90 degrees and the notch towards the left shoulder. In this view, we can get the short axis view, aortic valve level. In this level, we can see the aortic valves, the left atrium, the right atrium, tricuspid valves, and pulmonic valves. For this view, you don't want to move your probe. You just want to tilt it slightly inferiorly to get the mitral level. And in this level, you can see the mitral leaflets, the right ventricle, the interventricular septum, and the left ventricle. Continue tilting the probe inferiorly towards the patient's feet. For this view, you will see the papillary muscle view. You'll be able to see the right ventricle, the left ventricle. The papillary muscles come into view. Tilt the tail of the probe towards the patient's right shoulder to find the apex. There should be no visibility of the papillary muscles. This view is called the apical four-chamber view. The patient should be laying on their left lateral side. And in this view, you want your transducer over the apex with the notch facing towards the patient's left side or bed. And it could be more medial to lateral. In this view, we can see the left atrium, mitral valve, left ventricle, right atrium, tricuspid valve, right ventricle, interventricular septum, and intraatrial septum. And always make sure that in this view, you want to see it oblong, not foreshortened. This view is called the five-chamber view. To get this view, you want to angle or tilt the transducer more anterior to open up the left ventricular outflow tract and the aortic valve. This view is called the two-chamber view. You want to rotate your transducer 60 to 90 degrees counterclockwise and face the notch towards the right ear or right shoulder of the patient. In this view, we can see the left atrium, mitral valve, and left ventricle. This view is called the three-chamber view. You want to rotate your transducer 30 to 60 degrees counterclockwise from the second chamber. You want to face the notch towards the patient's right shoulder. In this view, we will see the left atrium, the mitral valve, left ventricle, aortic valve, and the aortic root, as well as the left ventricular outflow tract. This view is called the subcostal four-chamber view. For this view, you want the patient laying on a supine position, so flat on their back, and place the transducer at the subcostal window with the notch facing towards the patient's left shoulder. In this view, we will see the left atrium, the left ventricle, the mitral valve, the right atrium, the tricuspid valve, right ventricle, interventricular septum, and interatrial septum. This view is called the subcostal IVC view. To find this view, you rotate the transducer 90 degrees counterclockwise, aiming the notch towards the patient's head. In this view, the right atrium will be visible, as well as the inferior vena cava. During this view, you can have your patient take a sniff to see if your inferior vena cava collapses during this time.